Hey everyone, I'm John Hammerly with the Plastic Surgery Channel. The issue at hand right now is facelifts. I was told by a plastic surgeon who's long since retired here in Dallas. He said, you know what, John? Everybody has one good facelift. Do you believe that's true?
I think that was the way I was taught and trained, but it was also on an older patient that had the bigger facelifts. I think that has changed a bit now because we have a lot of other procedures that we can do and adjunct procedures that we can do. So you might start a patient, in their 40s, even in late 30s with like a little mini or a little micro facelift, add some fat to the patient, do some lasering or some microcoring or one of those things. So then they may not have that big facelift till later. And so finally you get the really big facelift that's gonna last at a much,
Major league facelift.
Yeah, a major league, but you don't do it in the very first.
You agree, Jason?
So John, I live and work in Florida, and we have a lot of older patients in Florida, as you can imagine, right? I do way more secondary facelifts than I do primary facelifts. And not that they're done wrong, they were done really well by well-known surgeons, but over time their skin relaxed a little bit and they're looking for a little nip and tuck. And we have other things to offer, such as my Elevate Plus for people who are looking for a little tweaking of their facelift. And as Rondi mentioned, we have lasers, we have Elicor. We got a lot of tools in our toolbox to help our patients.
Well, with so many tools, I guess one of the questions that I haven't answered very well is, what would you define as a facelift?
Well, I think for me, if I was going to speak about a standard facelift or the big facelift, I would say it involves elevation of the skin, elevation of the jowls into the right area, putting the fat back where it belongs, putting everything back where it belongs. And I do a very large undermining of the skin so that I have room to take off the lax skin. And I do a lot of elevation of fat and restructuring of the fat or repositioning of the fat. And also almost every facelift that I do, I put structural fat into. I don't think I hardly do one with that. And I usually do a combination of procedures. Usually it's a facelift, usually it's the eyes, and the structural fat grafting.
I think this is a very confusing topic for patients because some people say, I want a full facelift, and they have no idea what that means. So I always say a facelift is a lower facelift. And basically it works from the corner of the mouth to your tragus down. It doesn't do anything to your eyes, nothing to the forehead. We have other terms for those procedures such as blepharoplasty and brow lift.
Now, what happens when you get a 26-year-old woman and she's come in and she said, I've heard this thing about prejuvenation. Would a facelift fit into the parameters of whatever that word means?
Well, at 26, I don't think they would be having a facelift, but they might be a candidate for either a MyElevate procedure if they had big bands, but usually they won't at that age, or some maybe lasering, good skin treatments, such as like the Elicor procedures or peels, that kind of thing. So I think at 26, those would be the options I would offer the patient.
And maybe in a massive weight loss patient who lost 100
Yes,
pounds,
that's
a
true.
facelift would be the right procedure if they're really hanging.
Yes,
But
that's true.
We have things such as soft waves, which is an ultrasound technology for little tightening. We have lasers if it's a pigment problem. So I think the thing is go to a physician, plastic surgeon, dermatologist, facial plastic surgeon, who has a lot of these tools in the toolbox and can find the right one for the right problem. And the answer might be kick them out. Maybe put them on some skincare such as sunblock and some mild skincare as a starting point. But listen, we don't have to operate on people if we don't think they're good candidates.
Yeah, I think that is a really good point.
We can say no. No is a good answer.
Yes, no is a good answer for many people because they just don't need it.
And I'll tell you, on the filler side of things, we have fillers and toxins, and the people coming in want more and more, and I'll do one of these. You're cut off for today.
Go home. We'll
Go
see you in a
home,
little
go
while.
home, come back.
All right, well, stick around for any more information that you need. John Hammerly, theplasticsurgerychannel.com. I've got the answers, and if I don't, these people really do.